Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
When the Trump administration terminated the work of USAID around the world, thousands of people were suddenly separated from their work and their communities. That unexpected termination was detrimental to their mental health. One country brought its own resources to help dislocated USAID employees deal with those challenges. Here to share more details of this important work is the program manager at Strong Minds in Uganda, Ms. Lucy Onen. Ms. Onen, thank you so much for joining me today.
Yeah, thank you so much, Ms. Terry. I'm really happy and delighted to be with you on this show.
Well, I'm excited to hear what you're working on there with Strong Minds in Uganda, especially with USAID. So could you start for us by describing the situation for USAID workers who were in Uganda and the challenges that they've been facing with the disruption in USAID programs?
Thank you so much, Ms. Terry. My name is Ms. Lucy Onen. I was the former USAID Chief of Party for Mental Health Integration Activity under Strong Minds. And my colleagues and I were all distressed. We were very anxious. And of course, people became so stressed because they never anticipated the stop work order. So this is still continuing with my colleagues, but fortunately for me, Strong Mind Global had to realign and re-strategize and recall all the staff who were working. And I'm fortunate to have been given opportunity to become the country program manager. And there are many things happening right now in the country as far as the former workers or staff of USAID and their partners are concerned. One, currently, they're struggling with depression. They are struggling with stress. They're struggling with anxiety and uncertainty because they were laid off at the time they least expected. Just like you're just beginning the year and you're told to go back home, And that was a striking moment for them, a turning point in their career and in their lives as well. So because of that, they went into a psychological mode. Some of them were numbed. Some of them were reacting in ways that other people, ordinary people, could not understand. And therefore, right now, as I talk, those who have being laid off completely are in a state of redundancy because from a very busy schedule, and USAID, we are always on time. So amidst the busy schedule and that abrupt change in the lifestyle and career, they are rendered redundant. And if I give them a phone call, "Hi, Chief, how are you doing?" They're like, "Lucy, I don't know what to tell you, but thank you for your support and continuously checking on us." So a lot of redundancy because they're not in any gainful engagement or activity. And then also it affected the government itself in terms of, because USAID had a big hand in supporting the health, the health system or health sector. And therefore, we see a lot of people affected, even those who were on earth, those who were receiving medication for HIV. Some of them have resorted to sitting at home because they thought there was no possibility for a refill. And because of that, suppression is becoming a problem. So this is the general situation in the country.
Can you tell us a little bit about how USAID came to be in partnership with Strong Minds Uganda and what the relationship is there?
USAID, we had an informal relationship because we have several programs. And in our programs, we believe in partnerships. So the first one of the partnerships we had was iCare, which was focusing on adolescents living with HIV/AIDS. And we proved concept that integration of mental health into HIV/AIDS can improve overall outcome. And so that concept was picked up. And secondly, we, the leading mental health organization in the treatment of depression and anxiety. And to add on to that, we are the first and leading organization, I think, in Uganda to integrate mental health into different agencies' programming. Like we were working already with the local organizations and international organizations to integrate mental health into education, to integrate mental health into health systems, to integrate mental health into economic growth and development. So this gave us an opportunity to be chosen out. And besides, we have a very good working relationship with the government of Uganda. So we work with the line ministries like Ministry of Health, Ministry of Education, Gender, Labor, and Social Development, and others. So that gave us an opportunity to be chosen because we have a proven work experience in that area.
I'm speaking with Lucy Onen. She's a program manager at Strong Minds in Uganda. So what kind of support does Strong Minds provide to the folks who were working with USAID?
Thank you so much, Ms. Terry. In our previous work, when we started the implementation, we were providing technical support, us being the mental health experts in the country, in the scaling of treatment of depression using a very specific model called the interpersonal psychotherapy for groups. And that was one of the biggest things that we were offering to the IPs. But also after the closure of USAID activities in the country, we normally think big and act fast. We started providing psychological first aid to the former staff of USAID and their partner agencies. We also provided one-on-one treatment therapy to some of those who would like to maintain their anonymity. They do not want to be exposed because they are of different calibers. And of course, personally, as a mental health expert, we were, and the team, as the team, we have also provided direct support to the USAID mission in the country, taking them through the transition process and how they can overcome some of the challenges and build psychological and emotional resilience. Besides, some of them are participating even in our 6-week therapy. So that is how we are trying to support the former USAID staff and their networks.
Thank you for that, because I think it's so important. So many of our federal workers are experiencing similar situations, whether it's in the United States or they were posted abroad. Mm-hmm. What recommendations would you have for other agencies in terms of helping their displaced workers take care of their mental health?
Well, the most important thing is for us to recognize that mental health is key in whatever we do. And it is a multidimensional or multi-sectoral issue that we need to focus on. Before even the discharge of all this staff, there should have been a process for them to transition. And now that they're in a state of redundancy, there should be continuous emotional support. And that is what we are providing right now. And sometimes they are encouraged to have the support group because they were working as a group of USAID, and they were detached probably from their respective communities. So such interactions can be like remotely or physically. They have to continue to take care of their mental health. And any other opportunity for engagement should be given to them even after post-USAID engagement. Yeah.
That's great advice. What is next for the relationship between USAID and Strong Minds there in Uganda? You kind of brought us up to speed on where you are. What are you looking at for the future?
Our relationship remains open. We always appreciate what they have offered to us. We also appreciate how they have supported us. And up to now, we still have an open communication. So our communication remains open. We still receive some emails from them because they have not completely closed the mission here. In terms of continuous working relationship with the USAID, we have resorted to scaling in all the former USAID districts. So we are taking over their catchment areas and scaling the treatment of depression in those areas. And also we have devised a new approach which we have rolled out, which is the model district approach. Here, because of the dwindling resources, and yet we want to scale in all those previous districts that we had planned, here we strengthen the government systems and structures to leverage on them to provide services to the community. And I think this is a big thing for us so that we can try our best with the minimum resources that we are receiving from Echidna, which that is focusing on the young people, and also the GCC, the Grand Challenge Grant from Canada. So all these and other individuals that are supporting us to ensure that we continue to work. And with the support of Strong Minds Global, we are able to re-strategize and set priorities to continuously scale the treatment of depression at the lowest cost possible.
I've been speaking with Lucy Onan. She's a program manager at Strong Minds in Uganda. Ms. Onan, thank you so much for joining me, and thank you for the important work that you're doing there.
Thank you. I really appreciate this.
We'll post this interview at federalnewsnetwork.com/Federal Drive. Listen to the Federal Drive on your schedule. Subscribe wherever you get your podcasts.